The study by Liverpool University and Imperial College London looked at 16,749 people admitted to hospital in the UK. Some of these patients are still being treated for COVID-19, but of those with outcomes, 60% were discharged and sadly 40% died. Being male, older and having some existing medical conditions increases a patient's risk of dying. And just over half of the COVID-19 patients studied here had a pre-existing condition. Those with dementia had the greatest increased risk of death, 39% above average. But obesity is also a key indicator, with the chances of dying increasing by 37%. Although the range around that number is still quite wide. And clinicians say this link between obesity and the risk of death from COVID-19 is no coincidence.
Excess body fat seems to drive not just underlying health conditions that COVID-19 seems to exploit, but excess body fat also increases chronic inflammation in the body, so mild chronic damage to the body over a number of years. And what happens with COVID-19 is that people that tragically die from it die because of an exaggerated immune response that attacks the lungs, something called ARDS, or acute respiratory distress syndrome, which ultimately causes death in a tragic minority of people.
So let's look at how the levels of obesity in the UK compare to other countries around the world, many of which have been hit hard by COVID-19. The number of COVID-19 deaths in the UK is among the highest in Europe. And more than a quarter of adults, some 28%, are classed as obese. In the US, that figure is more than a third at 36%. But in countries with a lower number of deaths, like South Korea and Japan, less than 5% of adults are obese. One thing that is concerning scientists and researchers is the number of people from certain ethnic groups dying with COVID-19. We don't know why for certain, but it could be linked to a number of factors, including obesity. A recent Active Lives survey published by the Office for National Statistics found 72% of the Black, African and Caribbean community in the UK are overweight or obese, the highest proportion of any ethnic group. We are learning more about this novel virus every day, how and who it attacks. And the more information we have about those most at risk, the more lives we'll be able to save.